This is the story of inspiration, determination, and selfless care. This is the story of the largest COVID isolation facility in the Middle East, Hind Humanitarian City. The emergence of COVID-19 pushed us all towards a challenging time. The need of the hour was to provide care to people who were affected in large numbers and instill the confidence in people that the nation was ready to handle any emergency. Times like these are what inspire humanity, and the sequence of events brought together a collaboration of visionaries that would define our ability to battle the pandemic and conquer the fears. The journey of Hind Humanitarian City began with a group of philanthropic business leaders from Kerala who wanted to build a quarantine area for those afflicted. Mr. Harib Al-Falasi was presented with the idea. Together, with the support of the rulers of the country, all necessary preparations were completed within 24 hours. Strong and vital support, Al-Wasil Properties joined the battle by generously donating their newly completed staff accommodation compound. The next challenge was to transform the facility into a competent isolation and quarantine facility. To make this possible, an army of Kmcc volunteers swung into action, and that resulted in the formation of the Crisis Management Unit. Business owners, supermarket employees, and taxi drivers worked tirelessly towards the common goal and furnished 26 buildings in record time. Dubai Health Authority joined the cause and provided their medical expertise and appointed some of their best soldiers to lead from the front. Dr. Amjad Al-Marzuki, Muhammad Kambar Matar, and Dr. Bassam Al-Khameri. In no time, buildings were equipped to accommodate up to 500 guests, while DHA took care of food, medicines, PPEs, and medical waste management. KMCC Crisis Management worked hard behind the scenes, furnishing new buildings, managing the housekeeping, and providing essential room service to the guests. KMCC volunteer doctors and nurses ran the first 4 buildings. Soon, this number progressively grew to a total of 15. Aster, NMC, Pakistan Association Dubai, Fatima Medical Center, Indian Consulate, and TKM College of Engineering alumni further augmented the efforts by managing the medical care of 7 other buildings. Hind Humanitarian City milestones. 30th March. Started with 9 volunteer doctors and 33 volunteer nurses led by Dr. Zakir Muhammad. 500 beds were assembled and furnished under 2 hours. 56 volunteer doctors, 116 volunteer nurses, 58 community volunteers joined the battle to fight the pandemic. 7,500 beds were managed by KMCC volunteer medical team. 1,786 swabs done in 4 hours. Total of 18,000 plus swabs performed. 21st April, first mass discharge. 78 days of relentless fight. Zero lives lost. Thousands of happy recoveries. Hind Humanitarian City, under the government of Dubai and Dubai Health Authority, stands tall as a testimony to generosity, collaboration, and unity. We also express our heartfelt gratitude to the rulers of the UAE, the citizens and residents, the whole expatriate community groups, for their selfless service in serving the country that we all proudly call home.